welcome back to my channel. In this video, we'll talk about osseointegration. It is a very interesting topic. The concept of osseointegration was given by Dr. This is important, Pen Ingvar Brain Mark. All right. Now, this is a very famous quote by him. He says that no person should have the unfortunate privilege of dying with his teeth lying in a glass full of water on the table alongside his bed. So it is a very funny quote. That is why he propagated the concept of osseointegration. All right. So what does osseointegration actually mean? In the simplest of the terms, I would say it is the integration of the implant to the bone tissue. All right, without any intervening soft tissue. All right. Now, osseointegration, as defined by the American Association of Implant Dentistry, is that the definition is it is the contact established without the interposition of non-bone tissue between normal remodeled bone and an implant, entailing a sustained transfer and distribution of load forces from an implant to within bone tissue. All right. Now this is very easy to remember. It just looks like it is very complex, but it is easy to remember. But if you want to write it according to GPT-9, then the definition would be that this is an easy definition. It is an apparent direct attachment or connection of osseous tissue to an inert alloplastic material without intervening connective tissue. All right, now I'll just make it easier for you to understand. Basically, you just need to remember a few keywords. All right, so the first one being that it is a contact established without the interposition of a non-bone tissue, which means connective tissue. All right, with normal remodeled bone, whenever we put an implant, the bone is going to resorb and then it is going to be deposited, so it is going to be remodeled. All right, remember from that. So we're going to have a normal remodeled bone as well as the implant we have put. Okay, the contact between them, entailing a sustained. Now, why are we putting it into the bone, and why are we making sure that there is a contact? So that there is the sustained transfer of distribution of load forces from the implant to the bone tissue or within the bone tissue. All right, now this is an easier way. Keyword is apparent direct attachment connection. Okay, inert alloplastic material without intervening connective tissue. However, Brain Mark sir also gave an definition which is very structurally oriented. I wouldn't write it here, but I'll speak it. It is basically the direct structural and functional connection between both the ordered living bone, which is remodeled, and surface of load carrying implants. All right, this is also easier to understand. Now, coming on to why do we need osseointegration in dentistry? To remember this, you must remember PAR, then you will remember DO. Okay, PAR, DO. Now, by P, we have prosthetic rehabilitation of missing teeth. All right, because we're incorporating this concept into implants. All right, missing teeth or tooth. Then anchorage. A, say anchorage for maxillofacial prosthesis. Anchorage for maxillofacial prosthesis. Then by R, we have rehabilitation of congenital and developmental defects. By D, we have distraction osteogenesis, which is going to be the next video. This is very interesting topic and you will like it. And this is the very love of orthognathic surgery. All right. So then by O, we have orthodontic anchorage. All right. Now coming on to the theories. So there are basically two theories. Now first one being the fibro-osseous integration, and the second one being the osseous integration. Now, as I told you earlier, in osseointegration, you will see that there is no intervention in the connective tissue, But in fibro-osseous, you will see that there is a concept of soft tissue anchorage. Now, let's talk about fibro-osseous in detail. Now, in fibro-osseous integration, you can also call it as pseudo-ligament integration. Then you can call it as peri-implant integration. All right. Now, in this, there is a concept that there are collagen fibers present in the PDL. All right. And they have similar function to the Sharp's fibers which are present in the normal dentition. So, what happens is, According to this, it says that the collagen fibers, I will do it a little faster because the main topic is osseointegration. Now, collagen fibers, they function similarly to sharp-based fibers present in the normal or natural dentition. Now, the concept is that the fibers are arranged irregularly and parallel to implant. Now, forces are applied. They are not transmitted because of these forces. They are not transmitted through fibers because of these fibers, right? So, this inhibits bone remodeling. Now, failure of this theory. Now, what we see is, वैसे तो they are saying that this pseudo peri-implant fibrous membrane is similar to the periodontal membrane and it is going to give a cushion effect. But however, there is no such evidence and the force is also not transmitted, and due to which the remodeling is not expected, and the force applied is resulting into a widening fibrous encapsulation. Very important fact to remember here. Whenever there is a micro motion of greater than 150 microns at bone implant surface, it will lead to fibrous encapsulation. It will not lead to osseointegration. This is very important to remember. It will lead to fibrous encapsulation and it will not lead to osseointegration. Now, osseointegration, I told you, it is not going to intervene between the connective tissue, direct contact, direct bone deposition on implant surface. All right. If the bone deposition is lost, then fibrous connective tissue will be formed. Now, this is also of two types. One is the adaptive osseointegration and one is the biointegration. Now, this is very interesting. In adaptive osseointegration, what you will see is the osseous tissue, it approximates the surface of implant, same, without apparent soft tissue interface at light microscopic level. So, no soft tissue interface. In biointegration, what you will see is it is the direct biochemical bone surface attachment at electronic microscopic level. Alright, now let's talk about the next one, which is the mechanism of osseointegration. Again, very beautiful process. In this, what we see is there are two parts. One is the primary bone healing and second is secondary bone healing. First of all, there is going to be, is it visible? Yeah. First of all, there is going to be blood between fixture and bone. All right. If there is blood, then there is going to be formation of blood clot. Okay. Now, the PMNLs, polymorphonuclear neutrophilic cells, leukocytes, they convert into phagocytic cells. All right. Now, these phagocytic cells, now this bone, while this is all happening, this bone clot will form procallus. Okay, then it will form callus. Okay, now what will happen is it has osteoblast and now there will be remodeling. All right, now in this primary bone healing, what happens is there is going to be well organized bone formation plus this is important, minimal granulation tissue formation. But in secondary bone healing, what you will see is granulation tissue formation plus you will see infection at the site, which will lead to prolongation of healing period. My handwriting really gets messed up when I use a gel pen, so sorry. Period. And then we have the formation of a fibrous cartilage. All right. Now, basically, in endosteal osseointegration, we basically want primary bone healing. All right.